And I job shot at dentists, and I figured that was not for me. I just felt like it was boring, honestly. I wanted to care for the whole person. Maybe the first couple months, we're not keeping our schedule full, but since we were one of the few in the area open to new patients, they kind of just came our way. Just being a clinic where patients choose to come and word of mouth has really helped us grow. I'd say if you are first starting out, do not be afraid to hire that first front desk staff to help. But it'll pay off because it's going to make your life easier. You're going to be able to see more patients.
It is scary. The first hire, I think, is the scariest. Being able to remove yourself from that front desk, it creates an automatic aura of professionalism and frees up your time.
Feel free to reach out to other NPs in Duet because we're willing to talk to you about our struggles and our ideas for success.
Being able to just reach out is definitely an added benefit. And it's one of the things I love about Duet is the ability to connect with other NPs and other advisors because you're like in your own silo.
I would say just in general for future NPs thinking about opening their own practice, just take the leap.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Today on Unsung, we're sitting down with Casey Lulay. Casey built a powerhouse primary care practice in Oregon. He started with mobile visits in foster homes, nursing homes, and care homes, and then he opened up a clinic from one rented room, ran it as his own receptionist and medical assistant, and grew into a multi-provider operation with a brand new building. He expanded his access in a community where patients were waiting months just to get in the door. This episode is about what happens when everyone else is full and you decide to be available. It is about hiring before it feels safe. It's about building a practice that can survive real life, including kids, burnout, and a calendar that does not care about your feelings. So let's jump into it. Here we go. Casey Lulay, thank you so much for being on the podcast. Really excited to have you.
Thank you so much for having me. I'm excited to talk to you guys.
Of course. So before we get into letting everybody know how amazing your practice is, which it really is, I've been there, can you let us know what made you decide to even become a nurse practitioner?
So I started out doing actual pre-dental stuff in college, and I job shot at dentists, and I figured that was not for me.
Wait, why? Why? Say why?
I just felt like it was boring, honestly, sitting in the same exam room, working on teeth. I wanted to care for the whole person. So then I decided to shadow at the local hospital, shadow some doctors and some nurses, and that kind of got me into the medical field.
Wow.
Yeah.
And then, so nursing was your calling at first?
Yeah, nursing was.
And then when did you decide, like, you know what, I'm going to go extra and become a nurse practitioner?
Probably after I worked at the hospital at bedside for a couple of years. I saw those other NPs, having not have to deal with bedside nursing, and I really wanted to do that. So that kind of made me want to go back to school.
Yeah. It's always a moment of like, do I really want to go back to school? And then you're like, yeah, bedside could do that to you. It'll drive you to
They can, yeah. At the time then, my wife was actually pregnant with triplets at the time.
Wow.
When I started nurse practitioner school.
Okay, so hands are full.
So I was like, gosh, should I push through or should I, take some time off? But she was a huge support, so I just stuck with it.
Yay. What's her name?
Sarah.
Yay, Sarah. Thank you for pushing.
Yeah, Sarah.
Because obviously, as our listeners will find out, it will all work out. So then you become a nurse practitioner. Where did you work at first?
At first, I worked for a small community health center in Central Washington.
Okay.
It's called Quincy Medical Center. I worked there for 3 months, and we decided it was too hard being away at the time we had the triplets. They were 3. And our oldest son, he was 4. So we had no family help there.
Oh,
so we decided to move back.
Far.
Yeah, it was far because it was about 6 hours from our area where all of our family is.
Oh, wow. That's hard.
Yeah.
So 3 munchkins, 4 munchkins.
4 munchkins, yep.
And then like far away from a support system. That's really hard.
Yeah.
So what was your aha moment? You were like, not only is this hard and I have 4 munchkins, but now I'm going to be crazy enough to open up my own spot. What made you do that?
I did clinicals with a NP-owned clinic in Salem, Oregon.
Okay.
So I always wanted to eventually do that because I loved his autonomy he had and, being his own boss, come up with his own schedule, things like that.
So you knew like it was always going to be your future. What made you finally take that leap?
After I kind of got burnt out with working for a big corporation,
Mm,
and I started out doing just mobile visits. So I was just doing home visits for patients and foster homes, nursing homes. So I was basically moonlighting on the side. Yeah. So I was moonlighting on the side doing that.
okay. So like you set up your PLLC and all that to do like
Exactly.
go door to door service.
Mm-hmm.
Okay.
Yeah. And then the time came, I found there was a need to actually open a physical clinic, a primary care clinic. That's when I took the leap and
Wow.
decided to do it.
So
Yeah.
you went and you bought a place right away, or you rented a spot?
No, we rented a space. It was just one room. I shared it with another NP.
Okay.
And I was my own receptionist, my own medical assistant.
Yeah, brother. I remember those days.
For the first year and a half, actually.
See if you can remember that year and a half. You opened up your own spot. That means there's not, steady income. Maybe there is.
Mhm.
You can tell me what kept you up at night.
I think affording the bills and being successful
Yeah.
was
Like,
the
did I
biggest
make
thing.
the
And
right
then,
decision?
yeah, I mean, yeah, should I? But I also was, even when I did that, I was also moonlighting at another clinic just 2 days a week to help supplement income.
Yeah. And that's really important. I think that's a trend that all the NPs that we work with in Duet, when they venture out, they keep something
Hmm.
for as
Yeah.
long as they need to. I don't think too many people are like, yeah, sure, just throw caution to the wind and just like jump all in. Um, did you secure funding, or was it just like as you worked, as you grew, you just kept doing it? Like, what? How did you?
As I worked, as I grew, we just used our savings account,
And then
and
you
it
did
worked
it.
out.
So then you went from one room to the building you have now, or was something in between?
So in between, we actually leased a building in 2023. I think that's the one you came and saw in
Yeah,
Staten. And then
that was a big building.
it was that. So I was leasing it, so I decided I wanted to actually purchase my own. So we purchased our own building last March, actually.
So before we get to this building, that was a big building. So you went from like a one exam room to like how many exam rooms was that building I saw?
5.
5. So like
Yeah.
overnight you went from 1 to 5. Did you not panic? Like, how am I filling these 5? Like what was it? Was it empty in the
So there's
beginning?
kind of a gap. I decided to hire another NP to
Oh,
help to help
double it
fill
down.
that.
Okay.
Yeah. So I took the leap on hiring my first other NP to help
Were you
me.
guys empty in the beginning? Were there days when you're like, eesh, or
There,
straight away
maybe
you were full?
maybe the first couple months, we were not keeping our schedule full, but since we were one of the few in the area open to new patients, they kind of just came our way.
I see. So it took you a few months to fill up.
Yeah.
And then
Since then, we've been well pretty much every day.
wow. And it is a really nice size practice. Um, and then how long were you there before you decided to purchase a building?
About 2 years.
2 years. And now you're in a new spot.
Yep, new spot as of June 1st.
Congratulations. That's
Thank you.
amazing. How many exam rooms do we have?
We have 6.
6.
6
And at
exam rooms.
any given time, are you 2 providers at any given time, or?
So actually, we now we're soon to be 4 providers. So there's 3 of us currently. Another NP will be starting in May.
Do you work at the same time or different shifts?
So we work currently Monday through Friday. Everybody works 4/10s.
Got it. Okay.
4/10. So our first patient's at 7, last one's at 4:30.
Okay.
And then the goal is starting in May, we're going to start opening on Saturdays and having one provider there.
So like rotating kind of call.
Rotating, yeah, exactly.
That's
So
beautiful.
then every single day during the week, there'll be 3 providers. And then Saturdays, there'll be 1 provider.
That's amazing. I love that so much. And then do you only offer primary care, or do you have other services?
So I still do mobile visits. I still go out to, care homes, foster homes, memory care units.
Wow. You yourself do that.
Yeah, just myself do that. I don't expect the other providers to do that. So I take that on, and I do that every couple of months. I go out and visit my patients.
Wow, that's amazing. Any other services? I don't know if you do anything else, or is it primary care, straight primary care?
Pretty much primary care.
Yeah.
Yeah.
So what's your typical day like as a practice owner? You're working for 4/10s, but I know that your day is very different than your employees who work 4/10s.
For sure. Yeah. Lots of after hours spent doing things. So I typically get up about 5:30, get to the clinic about 6 or 6:15. And then I typically leave between 4:30 and 5. And then when I get home, I usually go to my kids' sports and I either help
Right.
coach or watch them. And then I get home and I usually spend an hour or two going through inboxes, labs, stuff like that.
Yeah, do you chart the same day as your visits?
Yeah. So that's kind of our policy. We have to have charts signed by midnight of the day.
Oh, nice. How many visits
That
do
way,
you
there's
have
no
a day?
lax in billing and forgetting things.
Yeah. How many visits do you have a day per provider?
For provider, I'd say average of 18 to 22.
Nice. It's a nice size.
Yeah,
Um, so it's you grew rather quickly. Like, would you say from first, let's not count the mobile, from the first renting of your place till where you are now, how many years did that take?
about 4 years.
4 years. That's a very fast trajectory. You are aware, right?
Yes, yeah, I've been told that.
Yeah, yeah, it's a very fast trajectory, which is
Yeah.
great. What is the secret to the speed in which you grew?
I think just being, a clinic where patients choose to come and word of mouth has really helped us grow.
Yeah, you also must be in a is it a busy area, like a well-populated area as opposed to, like, super rural?
Yeah, so it's kind of semi-rural because Salem's about 12 miles away.
Okay.
But the problem is a lot of clinics in Salem are at capacity, so patients
Ah,
are finding some place to come.
wow, that's amazing. So outside of you, there's, like, a wait time for people to get primary care right now?
Yeah, I've heard some areas are like 6 months to even get a new patient visit.
That's insane. I mean, that is the secret to what's happening with nurse practitioners across the country where everybody else is closing the doors and we're opening ours, and that's, like, amazing. So in this crazy world that you have, what's like one habit or system that you've implemented that's been a game changer for your productivity or your sanity?
Yeah. So actually, our front desk implemented a little piece of paper they give to patients when they check in, and it will say like when is their next appointment due, when is their next annual exam due. So that way, the medical assistant and the provider can look at that before they leave. They fill it out and then they hand it to the front desk on their way out.
I see. So you're saying what you really like is the fact that before they leave, everything's their appointment set.
Yeah, then if your next appointment's set, so we're not playing phone tag trying to call them. Hey, you're due for a follow up. You're due for your annual
So you
exam.
physically hand it to the patient,
Hmm.
and then the patient's advised, please give this to your provider in the room.
Yes. Yep.
Wow,
Exactly.
I
And
get
then they
it.
have to give it to the front desk on the way out instead of just walking by and leaving.
Oh, I see. So you're like engaging the patient to make sure that
Exactly.
they're stopping. Wow, I like that. Do you also, in addition to that, just so we could all visualize that, in addition to that, is there a clipboard with like any any paperwork, or is that the only paper that's happening?
So we also do like the annual screenings, like the audit DAS, PHQ-9, all
Is
that.
that on paper?
Yeah, so that's on like a dry erase type paper. They fill that out and then they give it to the medical assistant in the room.
Got it, got it. So there's no like clipboard with anything like
No, there's not.
got it. So
Yeah,
that's the only paper that's kind of tracked.
exactly.
I love that. That is so awesome. And how do you balance the clinical duties with managing the business side, right? Because that's a challenge a lot of people have. I remember I think
Hmm.
that's one of the biggest challenge because everybody else just comes in and comes out, and you're worried about, like, the air conditioning and the shoveling and
Yeah,
hey,
everything.
so how do you manage it?
Honestly, what's a lot of support from my family. That's the biggest thing is that so Sarah's also now our office manager, my wife.
Oh, okay.
She was a dental hygienist and she decided to basically quit that and help me. So that's been a game changer with her helping me.
I love that. So outside, I mean, it's clear that there's a shortage in the area, and it's also clear that you do great work, but do you have any particular strategies that are effective for attracting or and retaining patients?
So honestly, Duet's really helped us with the Google reviews.
Mm.
I think since we've signed up, we've got probably I think we're at like 96 now,
Wow, that's big.
and that's within probably within a year. So
That's
that's really helped drive people to persuade them to come to us.
I
And then
get
also it's word of mouth. Instagram, Facebook, we share a lot of
yeah.
posts that we're accepting new patients.
Yeah, the Google reviews are very powerful, and we're always doing Google reviews, but we also our practice also used like Duet's way of doing it, and has definitely
Hmm.
made a difference.
For sure.
Um, yeah, I agree with you that there. What about how do you handle like staff and team management for just smooth operations?
Honestly, that's one of the most challenging things of the last probably
Mm.
2 years is finding good staff that actually want to be there.
It's true.
Because we've kind of went through some staff that did not want, so we had to let them go part ways.
Like front
But
desk
now,
staff.
yeah, front desk type stuff.
Yeah.
Because they're the face of the business when
Mhm.
patients walk in. So if they're not engaged and want to be there, it
Yeah.
makes everybody not want to be there. So
Have you figured out any like secret sauce things to do or still pushing through that part?
I think team building activities and just hiring staff that want to be there.
Yeah. What
It's
kind of
really
team
helped.
building activity do you do?
So we've done a couple team like visits to a baseball stadium in Salem to watch some minor league baseball,
Nice.
and then also just lunch parties, Christmas parties, things like
Yeah.
that.
That's all. Do you like to dance, Casey?
I do at times.
Okay, I was gonna say you say Christmas party, so I'm thinking dancing.
Yeah, totally.
Any other strategies that really been effective excelling in, we said marketing, but anything specific in operations or patient care or anything else that you can, impart to anyone listening?
I think one thing that's really helped us is becoming so we are now the highest tier 5 patient-centered primary care home in Oregon.
It's a big deal.
And we also are the first clinic in Oregon to get the health equity designation. We had an audit last May and we passed that audit.
Amazing. What does
That's
that
also
mean?
been a good way to like advertise for patients.
What does that mean for people who don't know that system, who don't live in your state?
So basically, we accept and we care for all patients, no matter no matter their gender, identity, things like that, and we strive to make them feel like wanted at our clinic and things like that.
Oh, nice. So that has helped in your marketing efforts, like
It
putting a
has,
badge
yes,
on.
yeah.
That's great. Do you have a lesson that you've learned from your journey that maybe other NPs could benefit from?
I'd say if you are first starting out, do not be afraid to hire that first front desk staff to help.
It's so true. Being able to remove yourself from that front desk, it creates an automatic aura of professionalism and frees up your time. And it is scary. The first hire, I think, is the scariest. Will I
It
make
is,
enough to pay their
yeah,
patients?
totally. So so that definitely kept me up at night. Is now the time to take a leap and hire that first staff and have to start doing payroll and everything else involved with that.
So terrifying, yeah. And like making like that's somebody's livelihood, and now it's on your
Hmm.
shoulders. Yeah.
Totally.
But you're saying, don't hesitate, do it. It'll work out.
It'll pay off because it's going to make your life easier. You're going to be able to see more patients,
Yeah.
which in return, that's going to, financially also work out.
Yeah. But you're right. There is a leap of faith there. Like some people want to see it on paper first
Hmm.
and then make the hire, but it doesn't quite work that way because there's only so much you can do. And you have to take that leap of faith to free up time for yourself. And then you
Totally.
suddenly add two, three more patients on your schedule and it just happens. And you have to
Yeah.
just like hold your breath for a second and do
Hmm.
it.
Totally. Yeah. Because those 3 patients, will, hopefully, help pay for that front desk for
Yeah.
the day.
And then some, of course.
Yeah. And then some. Yeah. Totally.
I love that so much. How do your personal values shape the practice that you build?
I would say empathy. My dad, right when I started NP school, he got diagnosed with stage 4 salivary gland cancer.
So sorry.
And he just passed away this
Oh,
last August. So so he was a big support for me, but seeing him go through all that really, built my empathy and sympathy for patients. To put myself in their shoes,
yeah.
their family shoes,
Yeah,
things like that.
that's a big deal, and you bring that in. That's important. Staying connected to that is
Totally.
important. And then also in a way, it's like in honor to his memory every time that you take care.
It is.
I love that so much.
Yeah.
Rest in peace. Um, that's amazing. What's been your most rewarding moment as a practice owner?
I would say honestly, getting the highest tier 5 designation because
Yeah.
that was a lot of
Hard? Was it
hours
hard to do?
spent. It was hard. I mean, probably 100 or 200 hours spent behind the scenes going through all these different things with proving we're doing certain metrics or doing stuff like that.
Yeah, that sounds intense.
It was a lot.
That sounds a lot. I think it's akin to like a patient-centered medical home. That's what we have here, but we
It
don't have
is.
tiers of it. So that sounds like
Okay.
you have to keep going and going and going.
Yeah.
Wow. What were some of your biggest challenges?
I think being the boss of the employees, that side of the business was probably the hardest because we had staff we had to let go because of performance issues, things like that.
Yeah, because it's not a skill set that you know or necessarily comfortable with, right? You're like, medicine.
Right.
You kind of sort of know
Hmm.
how to like run a day, maybe own a building, you have a house, you know how to pay your bills, but then
Yeah.
suddenly to be in charge of other humans in that way
Hmm.
is a learning curve that no one
It
teaches.
is. Yeah, because I kind of wish I took a class on that in college. How to manage staff as a business owner.
I don't know if anything prepares you, especially for that first time you have to fire someone. You're like,
Yeah.
because I'm sure, like, you think about it, you make sure it's gonna impact someone's ability to put food on the table. It's like there's so
Hmm.
much in there, you know?
There is.
And there's no, like, HR person doing it for you, it's you.
No, it's me and the wife. Yeah.
Yeah. So it's
Yeah.
really, and you might see this person at the supermarket.
Yeah.
So it's very, I'm glad you brought that up. I think it's something that many of us contend with, and like, and especially if it's the office, you're hiring locally. So there's a
Hmm.
lot there. There's a
There
big
is.
challenge. Thanks for being honest about that. So I think you said you're most proud of that tier 5 and the other word, which is amazing. What about the best piece of advice that you've ever received about running the practice?
So, when I was doing my clinicals with that NP-owned clinic in Salem, he basically told me, don't be afraid someday if you want to do this, just take the leap. Go all feet in and it'll work out in the end.
Yeah, and that seems to definitely be the case. What about if you can go back in time and give yourself a piece of advice? What would you do?
I would say do not be afraid to start my clinic earlier because it took me, I think 2014, it took me about 5 or 6 years working as an NP before I broke out and did my own.
Yeah,
Well, I was not happy, obviously working for someone else because of all their, rules and policies, things like that.
yeah, absolutely.
Looking back, I could have did it probably a couple years earlier.
I think the overall overarching message all the time is don't let fear, whatever it is, right? Fear of hiring your first
Totally.
person, fear of opening your spot, fear and like a lot of like negative self-talk is,
For sure.
is a lot. Do you have any future goals for the practice that maybe you haven't achieved yet?
I think the future goal is to start opening on Saturdays because
Yeah.
in our area, there's no local urgent care or immediate care. So patients have to either go to the emergency room or drive, 20 minutes to Salem to be seen, on the weekends. So that's kind of our goal for the community is
Yeah.
to offer Saturday hours.
That's a big deal. Yeah. We do Saturday hours also. We just don't take new patients on Saturday because,
That's a good idea. Yeah.
and it's been very helpful. So follow-ups and, patients
Hmm.
really appreciate that. So you kind of have to come in a weekday to set up, establish care. And then after that, you kind of gain access to that.
That's
Um,
perfect. Yeah, I'll do that. That's a good idea.
and something else, since we're sharing ideas that I did, I don't know how big your office staff is, but
Yeah. So we have 2 front desks. We're going to soon to have 5 medical assistants, and then we'll have 4 providers
so
and
we
one office
did there,
manager.
since the providers are kind of not don't have to work every Saturday. Um, we felt that maybe it wasn't fair to have the team have to work every Saturday. So we created alternate Saturday schedules. So it's a bit of a slimmer admin support staff on
Hmm.
Saturdays, which is one of the reasons we don't take new patients. But it gives the team like every other Saturday on, and they could also switch with each other if they have events or something. And so it's taken kind of that burden of like having to work every Saturday because it's also hard to hire.
It
Um,
is for that. Yeah.
yeah, it's just
Yeah.
very
So I think our plan is to do like every third Saturday with providers, and then on those weekends we'll just have 1 front desk and 1 medical assistant.
Oh, you're not planning to have every Saturday.
No. So no, no. So it'll be every Saturday, but it'll just be 1 provider on those Saturdays, so they'll all rotate, and then we'll just have 1 front desk, 1 medical assistant.
Yeah, so rotating that as well. That's
Yeah, rotating that. Yeah, that way they're not stuck working every
every
Saturday.
Saturday. Yeah, that's great. I love that so much. All right, so now moving on to just you a little bit. What's a fun or surprising fact about you that most patients or colleagues don't know?
So I'm an avid hunter. I go hunting every year for deer
Wow.
and elk. That's kind of a family tradition. I look forward to that every year.
Where in your state or
In my state, so we go over to northeastern Oregon for elk,
elk? Okay.
and
Is it
then locally for
rifle,
deer.
bow and arrow? What's
It's rifle.
wow.
Yeah,
That's
it's
that's
kind of a
that's an
tradition.
that's an interesting fact.
And then I also have 7 horses at my house.
Wow.
So we usually take some of those elk hunting with us as well. So it's kind of a fun thing to look forward to.
That's amazing. They don't get spooked by the rifles?
We usually don't hunt off them. It's more for like scouting it, before the season.
I see.
Yeah,
Wow, that's really awesome. Being in touch with nature is always great.
totally.
Now, if you were not an MP, what would you be doing?
Probably a large animal veterinarian. I've always
Really?
I've always enjoyed when my horses go to the vet and things like that.
Wow. Well, either way, it'd be medical is what you're saying.
Really, medical would just be more on animals. Yeah,
Right. And as we wrap this up, is there anything else that maybe you wanna tell our listeners, our audience that maybe I haven't asked you?
I would say just in general for future NPs thinking about opening their own practice, just take the leap. Feel free to reach out to other NPs in Duet because we're willing to talk to you about our struggles and our, ideas for success.
It's so true. Um, yeah, I think reaching out to people is really important. Being mindful when you reach out, like not to like, can you give me 5 hours of your time?
Yeah.
But being able to just reach out is definitely an added benefit. And it's one of the things I love about Duet is the ability to like connect with other NPs because you're like in your own silo, and other advisors. Casey Lulay, it's been an absolute pleasure to have you on the show. Thank you so much for sharing this. Your trajectory is amazing, and I have a feeling that you're not even close to where you're going to be.
Thank you.
Thanks
Appreciate
for
it.
being here with us. Well, that's a wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. Want to join the largest NP practice network? Learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.